Hey, what's up, y'all? Tyson Compton here and Christian Morris with Insiders of Omaha. I wanted you to get the first look at our newest podcast with Vanessa Young. She is an entrepreneur with a vast array of life experience at such a young age, and it's just impressive to hear about this niche market she is taking over in just a short amount of time. And you're going to hear a lot about what she does as a niche profession, but also about how she got there and some of the challenges she's overcome. So I'm excited for you to hear her story, and hopefully you take away some of it. Just local here in Omaha, she's doing great, as well as working it nationally. Remember, this is a podcast that we fund solely from our real estate business, so please like and subscribe and click on the buttons below. We'd love your feedback. If you have anybody that you'd like us to interview, please let us know. Or if you have any questions, please submit them below. And we are here for you guys. This is the Insiders of Omaha podcast, and this wearing the red shirt today for Go Big Red Husker football Thursday this year. And we'll talk to you guys soon. Enjoy the show. Peace. So I keep thinking of Vanessa Hamburger.
We're good.
Yeah.
Oh, that's
So you said business has just picked up like crazy. You were just telling me like literally 2 weeks ago, like, oh, it kind of goes slow. Like this time of year, you're like, what's been has it been caseload or just randomly or what?
I think that the market in September is a little bit slow. Like looking back at our past years, September is traditionally slow. Yeah. However, from the prior years, I have had a lot of new clients. So I think school was getting started in October or in
September,
in August, and then now that September's coming,
that's nice.
They're finally starting to
get back to work.
And
so one time you explained to me what you did. We were in that front office and you were talking about it. Explain it again, because I honestly don't remember that well.
So my company is Precision Life Care Planning and Medical Analysis. By trade, I'm an occupational therapist.
Okay.
And what my company does is we bridge medicine and law. So I have a team of healthcare providers that work for me, with me, and we work with other attorneys, physicians, and life care planners, and we help explain and go through record. We analyze records and then give that to the attorneys to help explain for court. Malpractice lawsuits, personal injury lawsuits, mass tort lawsuits. They get these clients that have thousands of records that come in, and traditionally the attorneys analyze them, but the attorneys don't have any medical background or knowledge or training. So what they do is they reach out to other medical professionals
that can decipher them, basically.
They can decipher them. So we read through them. We create a chronology. So basically that's just the order from oldest to newest. And then there's a section that says notes. And so we explain what labs mean. We explain if this person is going into renal failure, when it happened, when it occurred, and then the proper steps. Did the doctors or nurses, when they're reading these labs, did they call in a consult? Did they order the next proper labs or the next proper steps? Did they do what they were supposed to do, or did they continue to harm the patients?
Got it.
So it sounds like you are a huge leverage piece for lawyers to be able to support and defend their clients based upon whether it be malpractice, maltreatment, whatever that is. And then you help, hey, you identify oddities or missed pieces of what.
You ever have to go in court and speak?
Life care planners or healthcare consultants do. I have not as of yet. I've been doing this for 7 years now.
Yeah.
Feels like a really big case, maybe.
Yeah. So it depends on what you are being hired for. I have a law firm down in Texas, and they use me internally. So they don't use my stuff mainly for court. But we go through all the medical records, and then they go through them and pick them out piece by piece. But they're like, yours are like Cliff Note versions. It saves us hours and hours of time.
Huge
and you explain what labs are. You explain what different treatments are. Or if there's a standard of practice that should have been followed, you identify like they are not following the proper protocols. This patient they did not get. We're doing a lot of pressure ulcer cases. They did not get the proper protocol for when someone has a pressure ulcer, so they have a sore on their bottom. They didn't get the hospital bed, the pressure cushions for their wheelchairs. They weren't turned on a proper protocol.
Interesting.
Yep. And just seeing where that negligence came in, and then they can pinpoint what hospital, what location.
So having a background in occupational therapy is one thing. So then, have you noticed your medical knowledge even grow more now because you're just analyzing so much medical notes?
Yes, exponentially.
Yeah.
And I get to look at different fields of practice, fields
Yeah.
of medicine.
Yeah.
So as an occupational therapist, no, I might not be able to, give recommendations for certain things, but I can see what all of the other professions have
Right.
done in the last 7 years with the same
Yeah.
type of cases, because we get very similar types of cases.
Right.
So I
And
can
there's still
see what the
similar standards of care.
Yeah.
Like there's processes to everything. Oh, wow. That's cool.
And so with my team of healthcare providers, so I'm an occupational therapist. I have other occupational therapists, but we have physical therapists. I have an audiologist, pharmacist, speech language pathologist. And then I have kind of a collaboration with a physician life care planner who got me started 7 years ago in this business. And if I have any questions, I can reach out to him as well.
For sure.
Or being in the medical field, you have a lot of friends that are in the medical field,
Yeah.
so you can reach out to other people and collaborate with them. Recently, we started doing expert statements. So if that law firm needs a nurse to list the standards of practice of care and why not those standards were met, they can actually give that statement with their credentials. They're all practicing. Everyone that I have hired is currently practicing within their fields. And then we can give those, and then those would be open to depositions and testifying.
So I'm curious, it sounds, I'm making an assumption here. You started doing this as a one-man band.
Yes. Yeah.
Right. And now you have, I think you mentioned like 7 professionals that you're working with, and then you have a team of admin staff behind that.
Yeah. So I actually, currently I have 8 W-2 employees, part-time employees. Though 5 of them are medical professionals, and then I have 10 other medical professionals that are independent contractors.
Right, for you.
Sense.
Oh, cool.
So they just
when
kind
you
of
need
work
them, you
when
reach
they
out
need
to them.
Yeah.
Yeah. When I'm really busy, I say, hey, I
Can
have
you
all
do
these
this?
cases. They have all been trained. They've been working for me for years, and they will help out whenever I need them. And then they also can help give testimony or give expertise in particular field.
So you go to school for, you go to high school, college, or college 4 years, and you go to occupational school, so that you have this mindset of going into this professional field. Yeah. And you're like, this is what I'm going to do. And all of a sudden you're like, well, now I'm a legal analyst.
Yeah. So I
Pretty interesting.
came upon this through the physician that I worked with. I was working in an inpatient rehab center as an occupational therapist.
Sure.
I consulted with this physician, the director of rehab, many times in this setting, and we kind of built a great rapport with each other.
Yeah.
And he is a certified physician life care planner. And he said, I have all these records. I need help going through them and analyzing them. Do you want to do this for me? He said, do you want to make some extra money?
Yeah.
So I agreed. I didn't know at the time that he had asked a few other of the healthcare professionals within that rehab facility.
And they said no?
And so some of them said yes. Some worked for him for a few years. Others worked for like a week or two.
Yeah, sure.
And I am the one that stuck around 7 years later, and I built a career myself out of it.
For sure.
He was a very big advocate for me if I got busy and I said, I'm having a hard time keeping up with the work. You're really busy. And he said, train other people to do what you do. You do a good job of it. Tell them how to do it. And so that's when, the idea got started to branch out. And he said, well, make an LLC. So I made an LLC. So he's been a big mentor of mine throughout the last 7 years, and go back and forth and help each other out.
One thing that's really cool is you're seeing this grow outside the borders of Nebraska as well. Like you mentioned Texas. What other states are you operating in?
So the physician life care planner lives in California.
Okay.
But Texas. I have clients in Texas, California, Wyoming. Massachusetts. Now I have a life care planner that's using me. And then I've had other life care planners for me to do their chronology. So I'll kind of explain the difference between the law firms and the life care planners. But up in Canada, I had some people from Canada reach out.
Interesting.
You are hitting
in Georgia.
That's
everywhere.
A huge spread.
It is.
Sounds like there's probably not a lot of people that do it though.
No, there's becoming more and more.
But now with 7 years of experience and the vast array of disciplines you're kind of covering.
I am. And I have a big support team that goes along with my company. A lot of individuals that help law firms
Yeah.
and that are certified life care planners, they like to do it themselves. They want to run their own business and they only want to work with themselves.
They
or with
want
one
to
other
be
person.
self-employed.
Yep, they want to be self-employed.
Yep.
They don't want to run a business.
Yeah.
Because as I've grown, I've noticed, you know, instead of working with the business, I'm working on the business. I'm especially with these W-2 employees that I have now, there's a huge responsibility for me to get the cases. Before, I would just work, and if I was busy, I would work extra hours.
Yeah.
And now when I have other people to
Depend on
rely
you.
on
Yeah.
me, it's more nerve-wracking
More pressure.
to get the
However, your
Patients
earning
goes great.
potential goes up exponentially.
Because your leverage piece is there.
You're leveraging. I mean, like now you're working not just doubling your own
Yes.
ability. You're actually quadrupling it. You know,
It
or whatever,
is.
10xing it.
I got a question, kind of random, but through doing all this and going through all these records and stuff, do you like get nervous going to hospitals? Like that they're gonna, like if you ever needed something, would you be nervous? Be like, oh, I see all these people not doing things correctly, or no? Or do you see more of them doing it good?
I see more people doing the correct
Okay.
things. And I always try to say I'm not trying to harp on other healthcare providers because there is a human element of mistake in medicine. But I am extra cautious when I go in and I ask a lot of questions. So with my family members, I always tell them, like, ask questions. They're doing something and you think that it's not exactly right. Ask them why you're doing
Just
it.
common sense stuff, right?
Yeah.
Yeah. Huh. So what do you think has been the biggest learning curve? You went from being a specialty healthcare provider to business owner, spanning the United States. What has been the biggest challenge, you know, that you've had to kind of overcome?
Learning the business aspect of it.
And I'm sorry, go ahead. I don't want to interrupt. Go ahead.
Before, when I was just by myself, I grew based on referrals.
Yeah.
I did not advertise. I did not spend. I actually was limiting the amount of publicity I was getting because I couldn't handle as much work. Yeah. So now that I do have a great team behind me, I am starting to advertise a little more. And learning how to advertise is a whole different entity in itself.
Everything seems so simple until you get into it. Then you're like, oh yeah, this is very complex.
Yeah. And I'm a very analytical person, and I do a lot of research and a lot of reports, and I speak more to information than I speak to selling. So I have a networking group. That's how I came upon this KW Elite. They told me, they're like, you have to sell your business instead of just telling people what your business is.
Totally.
And so that's been a different learning.
It's a different language, right?
Yeah. When I give a PowerPoint presentation, I give them, these are the facts of the case. This is what I do. This is how I remedy them. And it's very methodological.
And you've had problems selling with that? What? You had problems selling being that way?
No, I've just had other people give me recommendations, like feedback. Do a case study. I've had good feedback from my networking group. Do a case study and show them what you do. Yeah. Or you need to present why they need to hire you instead of just what you do. So
but like if you do it the way you naturally do it, which is just telling them the facts,
features and benefits, whatever. Yeah.
Have you had people turn you down when you present that way?
No, and so
it sounds like it's working then.
Yeah, it is working. Yeah. And I haven't done a lot of outreach, so I'm just starting the Omaha networking outreach to the different law firms.
Yeah, what's up, lawyers? Check this out, right? Plug Precision Legal here.
I'm going to the law conference, the National Trial Lawyers Association conference in September, or my company is. I will be in Canada actually, but and we're going to have our first booth.
Nice.
So that was
cool.
One thing that I decided to do a few months ago that's really been helpful for me is I took one of my biggest client, they're down in Dallas, and I actually went to visit them for 2 days. Yeah. They mentioned briefly that I should come up and just check them out one time. And there was no really follow-up. And I'm like, you know what? I'm going to just go down and see them. I talked to a few other life care planners and people in my business. And I'm like, you're spending the money to go down there? What if they just don't even have you come in the door? And I'm like, well, then I have a 2-day vacation down in Dallas. Oh.
So you didn't even tell me you were coming?
Oh, I
mean,
told
oh,
them.
okay.
But it's
Yeah.
kind of it was
Right, right.
non-customary in the industry.
Yes, I
makes
told them
sense.
I was coming, and they're like, "Okay, well, we'll see you." And there was never really great follow-up on their point, but I just kept telling them I'm going to come down. I actually said that I was just going to be in the Dallas area, like for
Yeah,
a vacation
whatever.
trip, and I was going to pop in and see them. They
Yeah.
didn't know I was coming strictly for them.
Yeah.
And after 2 days, I showed up at 8:00, and they led me into a conference room, and then lawyers started filtering in, and I talked about what I did, how I can expand on my services,
Sweet.
how they could utilize me. It was one of the best trips that
Interesting.
I could have
Yeah.
planned.
Well, especially since you did it organically, you probably came back. You probably learned just as much as they did. You're like,
did.
okay, hey, now I'm learning more about the legal space. I'm learning about how they operate, personalities I'm actually already working with. You probably got
Yes.
more ideas
Yeah.
how you could expand your services while you're
They,
there.
when I asked them how I could improve on my product, they're like, "Oh, your precision. We use your chronologies all the time." They're like, "We never actually knew who did these. We just knew it was a company."
Wow.
And so they're like, we have your files laying on our desks all the time. Every case we use, we flip through them and we circle things, and then we go back and check." And
Oh my
That's cool.
God.
so it
Wow.
was such a really
Now you're a
neat
person,
thing.
not a company name.
Well,
Yeah.
and you're creating a proprietary product. I mean,
Yeah.
you've created you've created from nothing.
Mhm.
Yeah.
I created it from absolutely nothing. And I had a different name at first. A lot of life care planners use their last name. So I had V Young Consulting. And when I started trying to grow my business a little bit, I was like, nobody knows what this is. It's hard to explain.
Great
So I came up
observation.
with the precision life care planning and
Yeah.
medical analysis to
Yeah.
tell people what I do in the name.
Yeah, no,
That's
good.
cool.
I was actually just talking about this with my dad because there's this restaurant that's just called, I forgot what it's called, like 7 Up or Eat Up, something like, oh, it's Eat Up,
Okay.
Eat Up.
Oh yeah. It's like, well, what are they?
And that's it. It doesn't say anything else on the sign. It just says Eat Up.
So like a Burger King, you know what's going to happen.
Right, burger. And then, but like even other things, they have like a little bit of like what food they have. It had nothing. And you like on the outside of the building, nothing. And I was like, you never see anybody there. And I'm like, yeah, because it doesn't say what it is.
Yeah.
So yeah, it's smart to be like
Mhm.
precision life care planning and medical analysis.
Yeah. And I can always shorten it
Simple.
to just precision if I want to do marketing
Yeah.
ads. But so there's 2 avenues in which I work. One is through law firms, and we do medical chronologies. We do case merit assessment. So they'll give me a case and say, "Hey, is there a case here? We're trying to weed out
Oh, got it.
what
Yeah.
actually is a case and what's not."
Yeah.
They have family members every day coming to them
Yeah.
saying, "I have a lawsuit.
Right.
Is there really a lawsuit, or was it just, an unfortunate set of events that happened?" And a
Totally.
lot of those are.
Yeah.
And so I will help them go through the cases and see
Figure out which
whether-
one they want to do or not.
Yeah,
Yeah.
see if they want to go to trial. I was talking to the partner down at this Texas law firm, and he said when they go to trial, it can be $500,000 to $1 million just to go to trial. So he was like, we have a lot of expenses, and if we lose that, we just eat that cost.
Yeah.
So taking these,
Because they probably do them based off of like, hey, we're not going to charge you anything.
No
unless we win.
retainer. Yeah. That is just a
Yeah,
win.
they do no
Because
retainer.
the people that are doing it aren't like wealthy, I would
No,
imagine.
no.
Yeah,
They're
no,
trying to
they-
get wealthy.
or
Yeah,
some.
basically,
Yeah.
yeah.
So that is okay. So
The
there's that aspect
lawyer
of
aspect.
it.
The lawyer,
That's the lawyer
that's
aspect.
one ladder.
The life care planning aspect of it is where my occupational therapy expertise come in, because I am given these cases by the law firms, and they're like, help me establish a monetary sum for future medical costs. So then we analyze the records, we go through them, and we look at all the bills that they've had currently, and then we reach out to all of their current providers, say,
Interesting.
what are the recommendations from now until death? And we can take, if they recommend they have to see a neurosurgeon once a year until they die, that's, can be between $400 to $700 a year based
Just
on
for that one
that
appointment,
code.
not including any follow-ups or anything else.
Yeah. And so that's, we can quantitate the actual sum. So some juries will say, people just want to win the lottery, but they don't understand that a simple
be really expensive, yeah.
Yeah, a simple car accident, medical fees, if they have to follow up, if they have a back injury, it can be millions of dollars just in medical fees.
Oh,
so
yeah.
if they're asking for $1 million or $2 million, they're not asking to win the lottery. They're just asking for their medical needs to be met.
Yeah.
So there is a huge
That makes sense.
Yeah,
It's a checks and
advantage
balance
using
system
us.
that you're providing. I mean, it's a,
I'm sure there is
It
some.
helps
There's definitely
justify.
some people that would be going after just trying to get it paid.
But
but
that's
There
also,
are.
yeah.
There are, but it also helps quantify why
Why that number? Why are they asking for this
Why are they
amount? Yeah.
asking for that number? And then if it goes to a jury trial, if the jury trial sees it, they can say, oh, now I understand why they're asking for that much money. And then there's pain and suffering and all sorts
Right.
of things included that I'm not involved in. But
Right.
at
Just
least
your
that
part that makes
portion.
sense. Yeah.
At least that portion of. So for the life care planning, so I also do medical chronologies for other life care planners that are busy, that they only want to work for themselves. They don't want to hire any W-2 employees. They don't want to train anyone. I'm trained. I will do their medical summaries for them, medical chronologies, medical summaries. I'll organize their records, and then they can build their life care plan off of that. Why that's important? A law firm can give you 2 or 3 life care plans all at once and say, I need them, in a month. For one person, it's almost impossible to do that amount of work in that time. But you don't want to turn them down, because as soon as you turn them down,
They don't give you any more business.
Someone else
Someone else
will sneak in. So.
Are you the only person who does the plans, or do you have other people that work with you do them as well, right?
Yeah,
Okay,
they're all
okay.
trained.
So
Yep,
it's
and
not
they
all
all
just you.
have. Yep, they all have their master's, doctorate degrees.
Sweet.
They're all professionally trained, and then I've been training them how to do the medical chronologies, and then the life care planning. You do not have to be certified to be a life care planner. However, it is recommended for court. I'm in the middle of my certification right now. They only offer the school that I'm going to, and another one of my healthcare professionals that works for me. We're both in the same program, and they only offer it 2 times a year. So the next one's in January. So we'll
That's
be doing
cool,
our very last module and then sitting for that.
What's the barrier of entry to get your life care?
I'm gonna head out.
Okay.
You gotta go to this other meeting.
Okay.
Thanks.
Pleasure
Sorry, I
to
gotta
talking
scoot,
with
but
you.
yeah.
That's all right.
Still,
Yeah.
I see, buddy. What's the barrier of entry to get your? Is it just, hey, I want to do this, and you sign up, pay something? Do you have to do some prerequisites for anything?
For the certification, you have to have 120 hours of study in the field of life care planning.
Okay.
So I have to take the courses.
Yeah.
It's a 6-module course. It
Yeah.
used to be in person, but now that you can do it online.
Okay.
And then you have to have a sample case life care plan that is presented to a board, and then it gets critiqued.
Yeah.
And then you have to sit for a certification.
Oh, cool.
So,
Wow.
yeah,
What has been
the
so how has it been hiring people? I mean, this is not something that you were bargaining for, right? And now you're like, well, I need to grow.
So this is actually a niche where I am fairly good at hiring professionals.
Okay.
I've talked to other life care planners, and they have a very hard time
Yeah.
doing it. But what I do is market it maybe a little differently than they do. I have a lot of other healthcare professionals that are now their moms, and they want to work less hours. So I don't have a strict schedule. They can work anytime they want. They can work in the morning, at night.
We just have deadlines. We have deadlines.
I just have deadlines. So we work on deadlines.
Yeah.
And I also have.
And this is all remote.
Yep, and it's all remote.
Yeah, nice.
So I have workers that work for me from Omaha to Kansas to Georgia
Wow.
to Texas.
Nice.
So I have workers all across the country. Most of them are classmates that I knew from occupational therapy.
Yeah.
And then word of mouth spread
Yeah.
in the healthcare field.
Yeah.
And so they have friends of their friends that have heard about it, that they still want to work. They want to work some out in the healthcare field, but they don't want to work a traditional full-time job.
Sure.
As you have little kids, you don't want to work 40 to 50 hours a week and drive and commute and travel. So if they can work 2 days a week at their job, and then they can work 2 days a week for me, they are able to have more of a work-life balance for themselves.
Awesome. How has it been maintaining communication 100% digital like that?
Yeah, that is the harder part. We have a lot of different ways that we communicate. I don't want to go into all of them, but we send out messages and texts and phone calls.
Right.
I try to meet with people often. I also do with my employees, if they don't work for a certain amount of time, they have to have a meeting, or they have to come and refresh on what we've been doing, because they're changing.
Yeah.
We've gone from the all independent contractors to the W-2 employees that have to log on every week and make sure they know what the changes are to the company, what the client's changes are. We constantly are getting feedback from what they want versus what we provide, because everything is such a personalized system.
Yeah.
So we are able to do that. So I keep my employees weekly. We keep tabs on. If someone hasn't worked for 2 months, they are behind the game on what we're doing.
It
'cause we're
evolves that
changing.
quickly.
Yeah, it evolves that quickly, especially within the last year.
Yeah. So what, I mean, have you, I started, and it sounds like to me, because you have so many direct reports, it's one to, you're looking at 10 to 12 at a time potentially.
Yeah.
Are you starting to notice where you might need like a personal assistant handling some of those stuff, like some of the admin side?
Yeah, I do. I
Yeah.
have an administrative assistant.
Okay.
I hired her this summer,
Cool.
and it was the best decision I ever made.
Why is that?
It was the hardest decision because they're I don't get money from the work that they do.
Not directly.
But not directly.
Right.
No, not directly.
Yeah.
But it was the best decision I ever made. She is able to handle my schedule, and she handles my calendar. She handles the employees when they need time off. She handles their calendar. She
Cool.
lets me know. She is a liaison between me and them, and any emails that are sent through, she kind of filters things out so that I can focus on the work that I need to focus on.
That's my next you're kind of leading that next question is, what you mentioned kind of what she's doing day to day and operationally filtering and kind of being a gatekeeper, but like mentally, what has she brought to the table for you to be able,
This particular person, so her mom was a CEO of a hospital in a small town. So she and her husband is in PT school. So she has a good medical knowledge and background, but she's positive and she's a sounding board for me. I run ideas off of her all the time and say, hey, what do you think about this?
Yeah.
So it's really lightened my mental load.
Yeah.
She's been, just an advocate for me. She
How'd you find her?
A friend of a friend.
Okay,
so one of our employees actually, she was actually a babysitter of her.
Okay.
Or she was her babysitter a long time ago. So now she's in her 20s, but she said, I have this girl, Kara, that her husband's in PT school. They're traveling around a lot. So she's not in her normal area, and she's just picking up substitution jobs at the school and at the daycare. I think she would be a really good fit for the company. She has a positive attitude. She's a go-getter. Her mom was in the healthcare field. Her husband was in the healthcare field. And it has been the best.
It's awesome.
Best work. And I try to find ways to utilize her more so that she can work more.
So I think it's really important. I think, and I have had multiple assistants, and a good one, depending on what their unique skill, some of them are really good about managing the business owner's personality. Some of them are super organized and cleaning up their schedule, organization. Some of them kind of a hybrid, but I feel like most people, that's probably one of the hardest hires. You went deep on provider and analyst when you could have went deep. You could have went individual admin assistant first and then went out.
Yeah.
But you realize you almost overdosed on the employee side, and there was no other choice to get an admin assistant.
There was no other. I had to have someone help organize some of the systems in place that I wanted to do for our organization.
Just couldn't get it all.
Yeah, as we grew, I didn't have time to work on the employee charts and the employee handbooks.
Right.
And so she's able to create all those. She's so proficient. I don't have to tell her what to do. She knows what to do. She makes to-do lists, and she has a monthly to-do list, a weekly to-do list. Every week we do a virtual Facebook or FaceTime meeting. Yeah. So we discuss what we want to do for the week, how we want to structure our week, anything that she has going on, I have going on, or any problems that she senses, because she will also hear emails, see things from other employees as she's contacting them, and feel if there's any animosity, or if someone needs more one-on-one time with me. If someone doesn't, then she comes back and says, hey, this person, I've noticed them say a few comments that they haven't talked to you in a while. I think we need to schedule a one-on-one meeting, a training, that they want some more one-on-one time with you. And then I can do that. I have other employees that don't really want one-on-one time with me. They prefer to be a little bit more hands-off and do email communication, but others want FaceTime.
Where are you seeing, or are you seeing other areas in your business where you can start, they call it, it's not white labeling, basically green packaging, content of training and stuff, like this, you're talking about being in the training one-on-one. That's time intensive. That's time intensive.
It takes a lot of time. Yes, I do see a future in that, and I have some other healthcare professionals that work with me.
Yeah.
And I can see them, that being their final goal is to owning their own business. Maybe not, maybe franchising, maybe not franchising, but packaging up how I do it and then showing them, teaching them how to do it, and then have them go ahead and start their own business, their own contacts, their own
So
job. Just
your
like this.
business knowledge is growing exponentially in the last year and a half, 2 years.
Yeah.
Started with BNI groups. That's kind of, obviously a little bit unique. You're not the insurance salesman. You're not the mortgage lender. You're not the contractor for building construction. So you have a unique set of skills, a lot of soft skills, a lot of interaction, a lot of analytical. What do you want it to look like? I mean, I'm not saying it comes to fruition, but ideally right now, you don't know what you don't know, but looking in 3-5 years, and you've seen the scale and scope of what this has gotten to.
Yeah.
What does it look like?
I don't know. I have some ideas. I don't necessarily want to say all of them because any business can take the model that you go. But
let me rephrase it.
Okay.
Let me rephrase it. What about your industry is getting you excited right now? What is putting fire underneath it? You're starting to see in this space.
Because I'm not. I've been in this space for 7 years, but I'm learning so much more. Just delving deeper into what services that healthcare providers can offer for law firms is the most exciting thing for me. I think a lot of law firms don't even know what these healthcare providers can offer to law firms and how easy they can make their life. We liaison between other healthcare providers. We can do expert testimony. We can do so many things, even organizing the records. We are bookmarking records, so it's easy for them to find. We're bait stamping records. We're just kind of an all-inclusive service that makes life easier for them.
So now you're touching upon a couple of it. Now you're talking about data compilation. Like you're compiling data, research.
Oh, research is that's like one of the hugest things. I always tell people if they want to work for me, they like to write research papers. Right. So that's what we do. We write and we research and we use sound data over and over and over all day long.
And then you're also creating proven logs. Like these are they're reference logs.
Yeah.
Right?
Yes.
That's interesting. My mind is just like going
huge reference logs. We are on the back end taking, all the cases that we do, and we have our own sets of PowerPoints, templates that we pull from them. So we don't have to go back and look at old cases and see, how did we do this particular case for this trial? We have it all pulled over. So we have everything in one shot so that in the future to train people, just say, well, look at our cost projections log. It will give cost projections for at most CPT codes that you would use in this facility, or most hospitals and how they charge, how they bill, what it looks like. Here are the different formulas that we use.
So 7 years, that would put us back 2015, 16.
Yeah.
How much are you following federal level changes in the healthcare coding system then? Like how much are you having to follow like with the like insurance stuff?
Yeah, I'm not following insurance things at all.
Okay.
So the costing that we use is their customary cost and their before insurance gets attached to it.
So it's so you're not diving into what Blue Cross Blue Shield is, Aon, any of that. So they're not doing that. Okay.
Some life care planners will take that personal piece and add that as an extra thing. But it's so impossible because you don't know what healthcare coverage that person's going to have from year to year. First, it changes year to year. Then they age out. Then they're in Medicare or they're in Medicaid. Or you can't look at the insurance cost because every insurance cost and policy is different. So we have to do it before insurance gets their hands on it.
So it's more, it's the gross, not the net.
Yeah.
Okay.
Yeah.
So not that I need numbers or
change.
anything.
No,
how did you start quantifying and validating what the cost of the value that you're bringing?
It's been researched by other life care planners, physicians.
So you're trying to see an industry averaging. an industry average of what
Yes.
your services
Yes.
cost.
So there are, or like my services are like what I'm projecting.
What your services cost. Like when you're like, hey, because you're building a business, you're like,
service.
well, I got to get paid to do this.
Yes.
How hard was that
So-
establishing, hey, this is my fee for service?
It's still
Evolving.
hard. I'm
Yeah.
a little low compared to some.
Okay.
I'm low to some because I'm still growing. However, I also think that so there's nurse consultants, there's healthcare consultants. Sometimes I think that those fees are overinflated for the products that they're doing.
Interesting.
I might get some flack for that.
No, I mean,
But
I don't know how many healthcare analysts are probably listening to this podcast,
No.
but
I mean, you can get numbers
Yeah.
that are hundreds of dollars of difference. You
Yeah.
can get as you can get in the $50 an hour. You can
Yeah.
get into the hundreds. I've seen $450 an hour for
Yeah.
reviewing medical
okay.
records.
So you are billing hourly.
I'm for certain services.
Okay, cool.
Most services we're billing hourly. However, for life care plans, we're doing a set fee, and there's
Package.
a certain package
Yep.
deal.
Yeah.
There's a certain number of hours that are built into those packages, and then anything that goes beyond, then we bill hourly for those.
And that's up front. And how, communicating that with a client, being clear and transparent, how important is that conversation when you are trying to build those relationships?
It is. So I have cost sheets. I have price sheets.
Uh-huh.
We don't go directly to the person that is hurt or injured. So we're billing life care planners, or we're billing the lawyers.
Yeah.
So those conversations are a lot easier because they see what we charge.
And they know, yeah.
And they know they're expected to be a little bit
They know
higher.
it's going to be a cost, yeah.
Yeah, because it's a specialty.
It is
and it's
specialty for
building their
sure, yeah.
cost.
Um,
And
when
a $5,000 to $10,000 life care plan can get someone millions of dollars extra.
you're seeing that the
ROI.
ROI,
is
yeah,
huge.
thank you, is definitely large. What when you started this and you made the jump full time, what was that like, going from, hey, consistent work, I'm an occupational therapist,
Yes.
and
So-
now I'm contracted.
I was lucky because when I first started occupational therapy, I did it for a full year.
Uh-huh.
And then the physician that I worked for said, hey, do you want to work for me on the side? So I did that for 5 years. I was
Wow.
still practicing for 5 years, going with this particular physician. And then I got a few law firms, and then, then I would have one or two more people. And it was 5 years. And it was actually after my son was born. He's 18 months old now. So I've been doing this for over a year full time now.
Okay.
But I went back to work after maternity leave, and I was leaving money on the table going to work as an occupational therapist.
Perfect.
I was like, I have to jump in with both feet. And my husband's like, we're losing money when you're going to work.
So he recognized the opportunity
Yeah,
too.
he
What
did.
a great feeling that.
Yeah. And he thought, you should have done this a long time ago, but I was scared to leave
Yeah.
that steady paycheck over and over. Since I have jumped in, the business has grown exponentially because it has my full attention.
What do you think? What kind of difference has that made in terms of, I would just say, in terms of lifestyle or the work-life
Quality of
balance that
life.
made since you made that change?
It's undeniable how much our lives have improved.
Yeah.
We have a 3-year-old and a 1.5-year-old, so our lives are busy.
Yeah.
But my husband goes to work at 6:30 in the morning, or he leaves at about 6. I get the kids up and ready. I take them. We have 2 big dogs. They go to the park.
Yep.
So we take them to the park real fast. I come home, I
Yeah.
work, and then my husband picks the kids up at about 3:30, 4 o'clock. So they're not in daycare all day long.
Yeah.
There's nothing wrong if they are,
Yeah.
but they have a shortened day.
Yeah.
That's how we
That's how
like
you
to
operate.
do it as
Yep.
a family.
Yep.
I can put food in a crock pot. I can cook
Yeah.
dinner. If I want to work out in the middle of the day,
Yeah.
if we're slow, I have the freedom to do it. I'm not just sitting at
Yeah.
the clock at the nursing home or at the hospital where I
Totally.
worked and waiting for clients or waiting for
Yeah.
patients. So, and I can make the decisions myself. That's the greatest thing. And sometimes as a business owner, I put myself last. So
Right.
my pay is last.
Yeah.
My hours, if a case takes a long time and I'm thinking, we've had some new training people, I cut my hours and I just give them the people hours. So if we bill hourly, I just don't bill my time because I don't want to disservice the not the lawyer client, but the person that we're helping
Yeah,
their client.
yeah.
If I feel like we should have maybe been a little faster,
Uh-huh.
then I can have the freedom to do so.
That's interesting. So you
Yeah.
you're still, it's still heavy upon you about the emotional work you're doing for these people. Because
Yeah,
somebody, I mean, that's
it
that's
is.
weighing. I mean, that's
Yeah,
infiltrating in
people
your mind. Yeah.
always think like, oh, well, you're working for the lawyers or the other life care planners. But when you read these records day in and day out, you're reading the history of the
Yeah.
person and you're seeing the hardships that they faced, whether
Mhm.
it's neglect, whether
Yeah.
it's just a fluke accident that maybe happened at work and they're trying to get workman's comp to cover
Yeah.
it. It just depends on what the situation is, but you feel for them. And then I don't overinflate my prices because the client in the end pays for the
And it
life
is
care
passed
plan.
on. Yeah,
It's passed
totally.
on.
Yeah.
All the
Mhm.
work that gets completed by me
Yep.
gets passed on to the client. And
Mhm.
while the lawyers may or may not bat an eye, I do because
Yeah.
I know that it gets passed on to the
Mhm.
client. So it comes out of if they get awarded money, that gets taken out for
Mhm.
whatever I charge. So I really like to keep that in mind and not, you know, put all my costs on to the people that are that's the why we have the job that we have is because these people are putting themselves out there.
Right.
My mom was actually involved in a case. She was a client.
Mhm.
And so I just think of my mom every time
Yeah.
I do these plans for people to
Yeah.
not overcharge because inevitably she was the one that had a lot of pain from a surgery that didn't go the way it should have.
Mhm.
But that money that's awarded is getting taken out and it goes to me. So I don't want to
Mhm.
overinflate that.
Huh. Do you have any idea what the demographic is like of how the medical health care planners or the life planners of the country? Do you have any idea?
I don't.
Yeah.
I don't. I should.
I don't know where you get it. I'm just curious. Like, I've got to think you're
There's
probably younger in the
yeah.
compared to most.
Actually, there was a summit, a 2022 summit for
Okay.
life care planners
Uh-huh.
that I was reading some of the demographics
Yeah.
and the experience for 10-year to 20-year life care planners were significantly higher than
Right.
the younger
Yeah.
demographics and how long they've been doing it.
Right.
But I don't know the quantifiable
Yeah. Just
numbers
interesting.
anymore.
Because you're kind
There's
of re-entering a ground level because those will be aging out.
Yes, and there's a lot of female life care planners that
Is
I've
there?
encountered. There are, but recently, the last few weeks, I've had 4 male life care planners reach out to me and ask about my services.
Oh, wow.
So
Interesting.
up until just this last year, I haven't heard of any male life care planners other than the physician life care planners, which is a little bit more common, like
Huh.
the male that got
And
me into
life
this.
care planner is define what a life care planner is. When I think of it, I almost think it was a financial advisor, but it's not. It's standard of care planning.
Yes, it when future cost projection.
That's it. Okay.
So, a life care planner is a healthcare professional that was a healthcare professional in their prior
Yeah.
studies who have an extra certification,
Right.
and they work with other people who are injured or ill,
Okay.
and they provide a dynamic plan for future care.
And the
then the
cost of that future
cost,
care, so
yeah,
they
and
can
the
plan
cost.
accordingly, so they're
Yeah.
not
Yeah, so it's
wasting
kind
their
of
money. Okay.
people know what case managers are.
Yes. Yeah.
And case managers can be life care planners.
Okay.
Some are, some aren't.
Wow.
Vocational rehab
Mhm.
counselors can be life care planners.
Yeah.
A life care planner can be a physician, an OT, a PT,
Yeah.
a rehab counselor,
Yeah.
a vocational rehab counselor, a nurse. There's any.
So, for
most
example,
fields.
I'm thinking to myself, I had a friend in high school whose dad got a huge work comp settlement for working for a logistics company.
Mm-hmm.
And he's probably a prime candidate who he's probably fine on this workman's comp case. And now he's like, well, what's my rest of my life look like? My cost of care going to be?
Yes.
I'm 45 years old. I'm going to have a
Yes.
payment back from them for the next 45 years or until
Mm-hmm.
my end of life. What's
Okay.
that cost going to be?
Yes.
What's
for
the
sure.
rates of inflation? Cost,
Mhm.
these are all going into things.
Yeah, the rates of inflation goes to an economist.
Okay.
So that
there's a
usually
different-
the law
okay,
firms have
yeah.
an economist that they use.
Okay.
So I plug in the real numbers as they are of today.
Real data today.
Yep, and then the economist will
Cool.
project that. Life care planners can also be used within the field of trust. So if someone has an illness or injury and the
Yes.
bank's taking care of their
Yeah.
money, the bank's going to want to know how much does it cost for each particular year. And certain years are higher based on surgeries or
Yeah.
projected care or,
Yeah.
you know, it's estimated
Longevity
that
of
they're going to
risk.
have to have,
Yeah.
it's estimated, that they're going to have these 2 surgeries. We
Yeah.
can't really predict when the surgeries are going to happen, but you kind of just can spread them out,
Yeah.
and then the trust can plan
Wow.
how much medical care costs they're
Interesting.
going to need.
I think one thing that's really fascinating, I've always been a curious person, but as we've kind of gotten older, and you don't realize how many different ways there is to make a living,
Oh, yeah.
right? I mean, like, this is something I would never want to do. Like, I could never, like,
I've had other
you
people
wouldn't
tell
want
me
me
that.
as your life care planner. I am not the detail guy. I
It's
am not your
very-
guy writing research papers. I will speak about your research paper, but I am not going to be the guy who's already writing that thing.
I get a little nervous
But-
speaking.
Yeah.
But-
But I mean, like,
Yeah.
I think it's one,
'Cause I'm more
to
comfortable
take the
behind a
risk going
paper.
away from stability and security of a standard job that's very accepted and known, and
Oh, yeah.
I say easy in the sense of
Most people know
seeing
what
it,
a
right?
life or what a OT or PT
Yeah,
is.
right.
And
But-
we make great salaries. We have
yeah.
a good profession. It's
Right.
pretty I wouldn't say low stress, but compared to other jobs,
Yes.
it's
There's definitely
It's-
higher stress jobs in the healthcare industry,
Yeah,
right? And then
exactly.
you've run across this opportunity that you might not even realize was as big of an opportunity as it is.
no, I didn't. And I talked to other healthcare professionals and they've never even heard of what I
Yeah.
do. They didn't even know it
Right.
was a thing.
That's what I'm saying. I think that's why we love having you on here. Curious, you just have, over the last 7 years, last year and a half full time in this industry. Who is Vanessa today that she was not 5 years ago? What kind of growth have you seen yourself that has really impressed you that you're proud of?
I am very proud of what I do.
Yeah.
I always liked being an occupational therapist, but working with other people had, their caveats. And
Yeah.
I was proud to do it, but I am proud to own this. I am
Yeah.
proud to tell people what I do. I have a
awesome.
lot of passion for it. Even though it may not be the most glamorous
Yeah.
job out there, it is.
It's irrelevant.
It is. Yeah, I'm passionate about it. I
That's
like
cool.
to research. I like to read the articles that come out in the, it's called ARP. I like to contact new people. I like to tell them how to do it, what
Yeah.
I'm doing. And so I think that I could be a very big advocate for other healthcare professionals and, like you
Yeah.
said, maybe bundling some of my services and what I've not acknowledged and learned and passing that to others that can do
Yeah.
the same in their regions that they
Right.
live. So
Do you
it's hard to get started.
Yeah.
It's hard to get that first law firm, that first life care planner. You have to have those connections.
Well, and I think I opportunistic in terms of, I see your connections and relationships being built, but I think of my dad. He was a private investigator, self-employed ever since I was born or whatever. But like and that's largely that's what he did, is self-employed his whole adult career since I was born. But like the idea is you just need a lawyer to take a chance on you. Somebody had to take a chance, and now you built some validity, you gain some momentum, and now word of mouth grows, and now you've established a track record and reputation, which is exceptionally important in the industry,
The law firm that I speak about, this law firm in Texas a lot because I've been with them for 4 years. And they're a top 100 law firm in the country.
That's awesome.
And when I went down there to speak with them, they're like, you need to advertise your services. You need to go to the law summits. You need to put booths up. They're like, you have helped us so much save hours and hours of time from the work that we do. We would love to have you. And they have a nurse practitioner that works for them full time that goes through their cases and assesses them. And they're like, we're too busy for her even to handle. So they hired me. I do it. Yeah.
That's cool.
So,
That's awesome. Well, what if you had advice for anybody that would be not necessarily trying to get into what you're doing, but thinking about changing, or I wouldn't say changing, pivoting their skills into something different, what kind of advice would you give somebody?
I would find something first that you're passionate about.
Okay.
And then, or I didn't even know I was passionate about this until I started. But any opportunity that someone gives you, take it.
Okay.
There was other people that this physician asked, and they just said, I don't know. It just seems like a lot of work. And they turned it down. And now they come. So I've had like the one come back to me years later, and she was like, how did you even get started in this business? I'm like, well, don't you remember that physician that you worked for 2 days? And the physician that I have, he's a very, very, very smart man. He's a lawyer as well.
Yeah.
And sometimes he can be hard to work for.
He's not talking with kid gloves, right?
No,
He's
not
very
talking with kid
direct,
gloves.
right?
He's direct.
Yep.
He knows how he wants things, and he tells you how he wants
Yep.
things. And as long as you can
Don't take it
handle
personally.
that, not take it personally.
Yeah.
He has been my biggest advocate that I've
See?
had throughout this whole
Right.
business, and he hasn't walked me through things, but he has given me suggestions.
Yep.
And if I can keep up with him, he's like, you can
Yes.
keep up with anybody,
Right.
like, because he's fast.
I think what's really important there too is like you have been able to, well, one, working with diverse people,
Yes.
right? And then removing some of the emotion has actually freed you to
Yeah.
move forward even further because you're not taking things personally.
No, and I've never had. So
Yeah.
in my past
Thick skin,
life,
whatever, yeah.
before I became an occupational therapist, I was a funeral director for 5 years.
That's right.
Funeral director, embalmer. I worked at one since I was in high school.
That's right.
So I was able to talk to a variety of people, every type of person you could possibly imagine being a funeral director. And I was a funeral director in Omaha.
Oh my God, there's a whole
and
nother podcast,
there's a
Dana.
whole
Are you hearing
nother
this? Like, oh, let's just jump into what I used to be a funeral director. What?
It prepared me for the real world. You
Totally.
can't take things personally because anything that your client is going through is worse than what you're going through at the moment because they're dealing with death. Same as in healthcare or in this aspect, anything that those clients are going through are worse than usually what happened to me for that day.
That's awesome.
And so not only do I not take things personal if people get upset, but I also know how to handle people gently as well.
With tact, dignity. So let's just get a timeline of events. You graduated high school in 03, 05?
No, 05.
05. Went to college.
Yes.
And then you went to go be a funeral services.
Yep. I
Right?
went to Lincoln for a few years, and then I went and got my mortuary science degree.
Right.
In Iowa.
Yeah.
And then I moved to Omaha when I was 21.
Yep.
Started working as a funeral director and embalmer.
For a handful of years.
Yep. And then, so it was actually 2 years.
Okay.
And the on-call hours and the weekends.
Brutal.
I knew I had enough. I had friends that were actually physical therapists and a pharmacist. And they're like, you work more than we do, and you get paid a fraction of what we get paid.
I can do,
Yeah. They're like, go back to school.
Yeah.
So I went back to school, became an occupational therapist. And within my first year of being an occupational therapist, I came across this path. So I've been doing it simultaneously as I've been a practicing occupational therapist. But I always, instead of working full-time at a facility, I always worked, it's called PRN jobs or as-needed jobs.
Yeah.
So I always worked part-time, full-time, just so I could keep this gig because I knew that this was going to be big someday. I knew that if I could get my clientele up, I could go full-time. And that was always my goal, was to go full-time with this. And so that would be, as a healthcare provider, make sure that you don't go broke chasing your dreams. Like, don't.
Yes.
I've seen some people, like, they go head first in it, but they don't have a clue what they're doing. So you can wade in the waters for a while and learn the field before you dive
It'll take a little extra work up front.
I was working, when I first started, I was working a full-time job. I would work until about midnight, and then I would wake up.
Wow.
I would do a couple hours more work, then I'd go to work. And I did this for 6-7 months. And then my husband moved. He had a different career change, and so we moved. And from that point on, I started working part-time.
Wow.
And doing this on the side. And some days were rough. Some days, I didn't have the cases, so I would work extra hours at the hospital. But always having one foot in the door at the hospital helped me to continue on with this. But then when you're losing money, stepping into another place of work, that's when it's time to dive in.
Right.
You just go. But I'm lucky I don't have overhead.
One thing I'll tell you after hearing more of your story that is impressive to me is I think there's an immense amount of, it's subtle in the sense that it's not talked about, but it's obvious in the sense of your track record is the confidence to always bet on yourself. It sounds like you've just had constant confidence in yourself. I'm going to figure this out. I'm never going to be out. I might be down, but I'm not going to be out. Yeah. Right. And you just keep putting one foot in front of the other. I mean, from the vast array of different fields you've worked in to where you're at now. And I always tell people, your past is not it's part of your testimony, not your tragedy. Right. Like, this is part of who you are, regardless of good, bad, or ugly. It's helping you you always have the chance to change your future by the choices you make. And I think that's just incredible that you just kept making steps. Hey, you're always open to new ideas and learning more about yourself. And I think that's just a really important lesson for anybody is like, you don't, at 25, you get out of college and you go to your profession, you're not done.
No.
Like the world is your oyster after that.
I've always loved to work. I like to work.
Yeah.
From the time I was 14, I worked at a restaurant.
Yeah.
I worked at a pizza place, and I've worked in so many different.
Yeah.
I worked in security when I was in college. Any job that provides me with a good opportunity to make money and have a good life-work balance, I was in. It didn't matter what the job was. Cool. I would work it.
Yeah.
So and I'm always looking for new ideas. I've always thought about wanting to own my own business. Like when I was a funeral director, I thought, I'm going to open up my own funeral home. That was what I was going to do. Yeah. And after I got into the industry, I realized that it was a lot harder to open up your own funeral home. There's so much overhead. Your salary is pretty low as just a funeral director and embalmer, especially when you're first getting started. So to get a
that's why there's like all the partners in it now.
It's there's lots of partners, lots of family owned.
Yes.
I know. So I worked for Stratman O'Brien when I was in high school. And at one point they were selling, or one of them was selling out. And I was a funeral director. And I was like, oh, this is my hometown. Like, I should do this. And when I looked into what they were selling for, it was over $1 million. And I was making $15 an hour as a funeral director.
Right.
Like there's no bank in their right mind that would give me the money to buy in. So I know there's other ways of doing it. But in my head, that dream was kind of crushed at that moment. I realized the obstacles that it would take just to get into that. And I'm like, I don't want to work for someone else the rest of my life. And I've always been like that.
Entrepreneurial. Yeah. Well, that's awesome. Well, Vanessa, thank you so much for your time. I really appreciate sharing a little bit of your story. And I'm hoping this can help you with some more business and stuff. And look forward to hearing more about your future success. I can tell it's definitely going to happen sooner rather than later as you grow. So thank you so much.
Thank you.
Yes.